Are you pregnant or trying to fall pregnant? And have you heard of pregnancy multivitamins but not sure if they're really important or think they're a little bit of a hoax? Hello everyone, my name's Emma. I'm here on behalf of Parenting Genie and I talk about all things midwifery and pregnancy related. So tonight I thought I'd talk about whether actually prenatal vitamins are important to take in your everyday routine as you're pregnant, and if they are, why, and what are some of the reasons why us as a healthcare professional really recommend that you take these. So as I just answered the question then, yes, it is 100% recommended that while you are pregnant and also while you are trying to fall pregnant, that you take a pregnancy multivitamin. Not only to ensure that you have the adequate dietary intake, but also your developing fetus is receiving the nutrients that it requires when it is growing, particularly in those first couple of months where that baby is really drawing a lot of nutrients from your diet, and any inadequacies in this diet is actually going to cause some direct impacts, which I'll talk about shortly. So while a healthy, balanced diet is great, it can be really challenging to actually get all the nutrients that you need while your baby's developing. So, which is why it is so simple and easy to take a pregnancy multivitamin, as they include some really key components of vitamins, which I'll talk about shortly, which is usually not taken very seriously or taken in the amounts that you are needed to make sure that your levels are normal and also your baby's growing pregnancy and your baby's growing fetus. So the number one inclusion in a pregnancy multivitamin is the inclusion of folic acid. Folic acid is a super important vitamin. It's also known as vitamin B9, and this is a vitamin directly linked to the baby's formation of its neural tube. So within that first 28 days of life, your baby is rapidly growing and rapidly multiplying in cells. It is very small at this point, but one of the last things that forms in that month of pregnancy, which is your first month of pregnancy, is your baby's neural tube. So your baby's neural tube is something that will grow and develop and actually be your baby's spinal cord and your baby's brain. So you can assume that this is such an important part of your baby's development, and something that needs to happen very correctly and very at a biological level has to happen normally to make sure that there's no defects. So folic acid has directly been linked to the decrease in spina bifida misalignments. So the last thing that your baby forms, all of its DNA is together, half from mum and half from dad, and your baby's spinal cord will form like this, and your baby's spinal cord needs to form as a complete whole. So any gaps or any misses in this will cause discrepancies, such as disorders like spina bifida. And a super important vitamin in the formation of this is folic acid. So a lot of research has been done on this in the last century, and there has been a direct relation to the adequate dietary intake of folic acid and the decrease of spina bifida cases in hospital, which is a really great outcome for scientists and who actually discovered this. So a simple inclusion in your diet with a multivitamin of folic acid, which is about 400 to 600 milligrams a day, is literally all that's needed in that first month to make sure to drastically reduce your risk of spina bifida, which is super important. So the number one thing is that it includes the correct amount of folic acid. Folic acid is also found in foods such as leafy greens and some fortified cereals. However, it's not something that is easily taken in that amount that you need, particularly in that first month of pregnancy, and sometimes you don't even know you're pregnant, which is why the increased amount of folic acid in a multivitamin is so important when you are trying to get pregnant and as well as when you fall pregnant, which is super exciting. The second vitamin that is very important for you to include while you are pregnant is an increase in your iron. So I've talked about this before. While you're pregnant, you're not only supporting your own blood volume, but also your baby's blood volume and also the blood volume that passes your placenta. So your placenta is a lifeline to your baby. The blood and nutrients that is in you will pass through this placenta into your baby, and it has a direct correlation between how they grow. So something that is in your blood is your red blood cells and hemoglobin, and the number one nutrient that you need to produce the correct amount of red blood cells is iron. So iron as well is something that is found in most foods. However, as I said just before, your blood volume increases by 50% when you are pregnant. So you can only assume that you need 50% of more of the iron that you need to not only produce red blood cells for you, but also to your baby. So you can assume that whatever you're having now while you're not pregnant, you will need to drastically increase in your diet to make sure that you have the correct amount, which can sometimes be very hard in some cases, which is why taking oral iron in the form of a pregnancy multivitamin is really recommended, and really quite a simple and effective way of making sure that you're getting your correct iron. So as midwife professionals, we will of course test your iron just to make sure that you're getting the right amount. Some women are doing the right thing and taking their pregnancy multivitamin, but sometimes need just a little bit more. And we will let you know if your iron stores are being depleted at any point in your pregnancy, and we can let you know. However, if you are in that pre-counselling stage when you're trying to fall pregnant, taking multivitamin will also help your own stores, which obviously needs to be adequately enough to then help support your growing fetus. So it's never harmful to take a pregnancy multivitamin with iron when you're not pregnant. And usually it actually is hand in hand, goes helpful with your blood work, which you do when you first fall pregnant. Another thing that is in a pregnancy multivitamin is calcium. As you can assume, you not only need calcium to support your bones, but also the bones of your growing baby. And any any decreased stores in your calcium will also direct an increase to a decrease in your baby's calcium and teeth health as well in utero. Calcium is something that in today's modern era is a lot easier to consume in dairy products such as milk and yogurts. However, those who are lactose intolerant sometimes maybe do need to take that calcium in their pregnancy multivitamin. If you have any vitamins in your pregnancy multivitamin that you do not need and you are getting through your diet, that is actually totally fine, as your kidneys and your body knows its correct levels and stores of what it needs. And anything extra, for example, if you're getting the correct route of calcium and you're taking a pregnancy multivitamin, that's actually totally fine, as anything will be excreted, anything more than you need will be excreted throughout your kidneys, through your urine. So it's actually not harmful at all to have a little bit extra of something that you feel like you're getting the right amount of. However, I can almost guarantee that there will be some things that you are not getting enough of, which you definitely need to take with that pregnancy multivitamin. Another thing that's super important is that they have the correct amount of vitamin D. Obviously, vitamin D goes hand in hand with your iron consumption. Without vitamin D, you cannot properly absorb iron in your diet. So it's also something that's really important to have. As well as iodine and vitamin B12, which are super important vitamins for yourself and also your baby. So there are some just off the top of the head that are super important that you need while you're pregnant and while you're trying to get pregnant, just to support your baby, let alone in your diet and the busy life that you run. Thinking of these things that have foods rich in iron, foods rich in calcium can sometimes be a little bit challenging. So taking just a simple pregnancy multivitamin is the very first step that you can take, just to make sure that you are receiving the correct amount of nutrients, which sometimes can be lacking from your diet, which is very common actually. It's not anyone's discrepancy there. A simple tip is to sometimes take your pregnancy multivitamin in the morning and with food. So as it has that iron in it, it really is important that you do take it with some food. Otherwise, you might feel a little bit sick or experience some complications such as constipation. However, if you're experiencing any of these symptoms and it's really, really making you sick, then make sure you just talk to one of your pharmacists or your midwife, and we can talk to you about what we do with this information and how we work with you to make sure that you are getting the right nutrients and also not feeling too sick. So you can get a pregnancy multivitamin simply from any pharmacy, just to make sure that they have the ones that I talked about just then. Obviously, most pharmacists and pregnancy multivitamins do have these in them, but just to triple check that they have those important vitamins. Some of them have a whole lot of other vitamins, but that's totally fine. The ones I talked about today are the main ones. which is folic acid, iron, calcium, vitamin D, as well as iodine and B12. So those are the most important ones. So that's all I have to talk about tonight. I hope you found this helpful. We really do recommend that you take your Pregney multivitamin. Don't be scared if you missed one day, just take it again the next day. It's not an issue, but taking it consistently throughout your cycle and throughout your pregnancy is super important and something that's very simple to take every day. Thank you for tuning in tonight. Again, my name's Emma and I talk about all things midwifery related. If you have any questions, I will go live again next week, so please comment them down below and I would love to help you out. Please have a look at our website if you have any questions or need any advice on some of our midwifery related topics. Thank you to everyone that has joined and I will see you next week.